Good evening, all. Can I get a response in the chat box? Good evening, everyone. I think am I audible, right? I'm audible, right? Yeah. So, after the first session and almost 8 days of your revision classes and revision schedule, which I have been giving you guys, and I hope so you guys are following it. So, why do I want to have this session today? You will know that at the end of the next few minutes. So, good evening, doctors. This is session 2 of RRR by Dr. Raghu. And in the first session, we spoke about the strategy, the war room, the turning red boxes to green, and not being panic readers. Today, we are going to zoom in. So, today, what we are going to do is we are going to see some strategies for moving into the final year MBBS and moving from strategies to tactics. So, that day I was talking about strategy, and today I'm going to talk about some tactics which you need to follow. So, now we are zooming in. Now we are zooming in. We are not going to study what to study. So that day I was talking about what to study, but today I'm going to tell you how to study that. Okay, you already have timetable with you. You already have workbook with you. You already have timetable. You already have workbook with you, and you already have must to know topic and toppers place. All this I'm sending you on everyday basis, isn't it? Isn't it? But what is the real question? The real question is when you sit with the chapter, with the textbook in front of you, with the guide or whatever material you're using, what exactly should your brain do for the next 30 to 40 minutes? When you open a page and keep it in front of you, what your mind, what your brain has to do for the next 30 to 40 minutes, we need to know that. If you get that wrong, you end up at sitting for 8 hours continuously and feel blank after 3 days. So this session, I specifically named it as how to study, going deep into the smart reading and smart revising technique for the final year MBBS. Is it clear? So when people say smart study, when I'm going to tell you smart study, what you all think? Can you put it in the chat box? What you guys think with regards to smart study? When I'm telling you smart study, what you guys think in your mind? Not only you, if I am in your place also, I'll be thinking that smart study means shortcuts. Smart study means hacks and techniques. Smart study means 2x video from any of the apps which you are using. 2x videos in the app you are using. Smart study means all those small notes which others are preparing and you're just memorizing it like a follower of some religion, follower of blind follower, you're just following that. That is not what I mean by smart study. In final year, smart studying means you read with questions in your mind. It should be question driven and it should not be pages. Second thing, you revise by layers, not randomly. And you design your day around your brain state and not just a timetable that everyone follows, because you all have this one thing to do. You all go and see the toppers videos. You all see someone who will be like sharing their experience, but their experience is not your experience. That's what I want you all to remember. So by the end of this session, you should be able to sit tomorrow, open any topic, heart failure, pneumonia, CSOM, cataract, whatever it is. You should know exactly how to attack it step by step. It's not like reading. You're going to attack it step by step. How you are going to do that. That's what we are going to know now. Okay. Why normal reading is failing, everyone? Can you tell me? Why normal reading, whatever you are doing, it is failing, isn't it? Now, for the last 8 days or 9 days, I have been sharing you some timetable. Tell from your art how many of you were able to follow it fully, at least the must to know topics. How many of you completed it fully? In spite of me sharing the material, in spite of me telling where to read, what to read, are you able to do that? Are you able to do that? Where is the lag? Tell me, guys, where is the lag that you are facing? Most of the students study. Say they tell this term, I am studying for 8 hours. I am studying for 9 hours a day. What they do, literally, they open the textbook, start from the first line and read till the last line. Is it happening? No. They don't even go for the second or third page. They become tired. They close the textbook, feel that I have studied 3 hours today. Your parents will be asking, what did you read? You don't know to tell what you read, but you will be definitely telling, I read for 3 hours today medicine. But is that matters? The problem with you all is the exam does not ask you to recite the chapter on pneumonia. They are not telling what is Arison or what is your Mandappa gives about pneumonia. Is this the question that asked to you in the exam? No, it is asking you classify pneumonia. It is asking you write a short note on community acquired pneumonia. It is asking you to write Light's criteria. It is asking you to write about curve 65. It is asking you to write about curve 65. This is what your questions are asked. It is not asked just recite whatever you read in pneumonia. This is not the question that is asked in your exam, isn't it? So your brain does not remember if you're going to continuously read a paragraph. It remembers question and answer. That is why the smart reading means not reading paragraph and paragraph. It means you need to convert. You need to convert those paragraphs into question and answer. Don't read paragraph. Integrate them. That is what it's not my opinion. It's the examiner's opinion. That's what the examiner needs from you. So this is actually called as a micro protocol. So I am very fond of giving you protocol. That day I was giving you 80-20, isn't it? That day I was giving you 80-20. I was giving you some Pareto's principle, this, that, and all, isn't it? Same way, today what I'm going to do is, today I'm going to give you a protocol. 5-10-2. What is this 5-10-2? This is a micro protocol you can use from tomorrow for all the topics that I'm posting in the group, for all the subject I'm posting in the group. For example, use an example like this. So today's topic is bronchial asthma, or today's topic is pneumonia. Let's take like this. So what you're going to do is, first, when you start with this bronchial asthma, bronchial asthma, just take 5 minutes. Just take 5 minutes. You are not going to read line by line. When you take a book, what you're going to do is you're going to scan through. You're going to see the heading, subheading, table, algorithm, boxes, bold words. How many is there? How many tables are there? How many questions are asked in this particular topic? How we are going to frame it? That's what I want you guys to know. So first, don't read it. 5 minutes, scan where the examiner might ask you a question. In that 10 paragraphs that you have in your Davidson book, that is going to be there in your Archit Balur book. What you are going to do? You are going to see where all your examiners are going to ask you question in this topic. First, understand that. Ask yourself, if you are an examiner, if you are in your place of your HOD, where will you take question from this page? Which MCQ you will ask from this page? Which topic you will ask from this page? Ask yourself. So for pneumonia, you will be seeing etiology, classification, clinical features, investigation, treatment, complication, and there will be a table on CAP, community acquired pneumonia versus hospital acquired pneumonia. This is what I remember from my UG days, what I had seen in majority of your books. So each of these is going to be a potential exam question. Okay. So remember, can you understand? So this is what you need to see. This is what you need to see. Next 10 minutes, what you are going to do is convert those headings, whatever you had seen, into questions. Before deep reading, convert those heading into questions in the margin or have a separate notebook. For example, etiology. From etiology, what they can ask you, what are the common causes of community acquired pneumonia? Complications, what they can ask you, what is the early and late complication of pneumonia? What they can ask you in the treatment, how do you manage a community acquired pneumonia in an adult? What is the Light's criteria table? How do you differentiate a exudate and transudate? So this is what you're going to do for the next 10 minutes. Before you start with any topic, do this. 5 minutes scan, 10 minutes write down. Then you will be taking a very small time. Now comes the smartest part. Pick one question at the time. For example, don't read essay on pneumonia. It is not going to be your question. You take etiology of pneumonia, take that, or complication of pneumonia. So in the complication of pneumonia, read only the subsection in the book. Close the book. On a rough sheet, write down 4 to 6 bullet points which came from your memory. You read that one paragraph, complication of pneumonia now. Out of this complication of pneumonia, whatever you read, what you're going to do is make a bullet points out of it. Make a bullet points out of it. So you are doing this by taking a rough sheet. You're going to do this with a textbook. What your question bank workbook is already there. In your question bank workbook, already I have divided small essay, short note, everything. First question, and then take 5 minutes, take 10 minutes, take 2 minutes. Repeat this 2 minute cycle for each question you write. Okay, 5 minutes, you're going to scan structure, 10 minutes, create question, 2 minutes per question, you read whatever there in your book. So in that case, you know what to read from your book. So now you are very clear that 10 minutes prior to that, you will be like clearly mapping it down. This one particular thing I'm going to read from this book. This one particular thing I'm going to read from this notes. Map it down. Then 2 minutes you take. 2 minutes is more than enough. Read it. Then close your notes. Write down. This is the difference between I have read asthma. People can tell you, sir, I have read bronchial asthma fully. But there is another way to tell. I can answer any question that is asked from asthma. Which is better? Knowing everything about asthma, that is impossible. But you can answer any UG level question that is asked on asthma if you follow this. Clear, right? Then that's what I told you. Textbook heading, etiology, clinical features. This is how you're going to. But your question is going to be, what are the causes of community-acquired pneumonia? How does it present clinically? Differentiation between exudate and transudate. Early versus late complication. Once you read like this, you will be able to pass your exam very easily. Then comes skeletal notes versus overwriting the notes. So this I want to tell basically. If you see here, I have overwritten this. Can you able to understand it? Can you able to understand it? So below I have given something. Above I am given some no some words. So this is how we make notes basically. What we do is we will try to write down on the notes itself. We will write down additional point on your book itself. At the end, you will not understand your handwriting. You will be feeling confused. So when you read like this, you will be tempted to make big, beautiful notes. Use 5 colors, decorate pages. Please don't do that. Don't decorate pages. That is not going to be your. I have seen many people trying to make a beautiful A4 sheet. They take a A4 sheet very beautifully. That is wasting your time. At least now resist that. For final year, smart output is needed. You don't have to write the entire essay and keep it and save it. What you need is a skeletal notes. What you need is a skeletal notes. What is a skeletal? Take a art failure as an example. Skeletal notes, as I told last time itself, it should not have the entire thing. It should have definition. It should be mentioned like this: definition, and then etiology, pathogenesis, so say, clinical features, left-sided, right-sided, and New York Heart Association classes, and then X-ray, ECG, echo changes, BNP changes, management. What is the difference between acute and chronic? What are the drug you're going to use? Diuretics, ACE inhibitors, beta blockers. You're going to write that. And non-pharmacological devices. One page. You're going to write only 1 page for the essay. Only headings. If you're near that headings, leave some spaces. Write down the key words in a bullet point. As I am sharing you guys, I have shared you guys, right? So those are the bullet points. Now what you're going to do is, you're going to close your books. You don't have anything. Now definition. What is the definition of heart failure? I have read somewhere. I have read in the Harrison. I have read in the Davidson. So now try to recall that. So now try to recall that. You don't have to write it down. You try to recall from whatever you read from the textbook for that particular question. You are going to define heart failure. That's what your mind should come off. You should not, your mind should not remember all the 20 pages of heart failure. Your mind should remember only the definition of heart failure. This is how you're going to remember. See, if your notes takes longer to read than your textbook, then what you're doing is wrong. Your notes has to shrink information. It should not expand it. So, question, first reading, section wise, active recall, skeletal only notes. So, what is a smart study? Smart study is nothing but, what is smart study? It is not shortcut, it is not hacking. What I'm telling, first question, first reading. Okay, question, first reading. That is the point number one. And now point number two, section wise. Section wise, you are going to do active recall. Active recall. And third, skeletal notes. Skeletal notes. So these three are the features of smart reading. If you are going to stick this pattern for more than 24 to 48 hours, you will achieve success. You will achieve success. Then comes reading well is the off battle. The other off is revision. Sir, I read everything, but I don't have time to revise. Then that is also a failure. Again, revision is not revision for more hours, 10 to 12 hours, sitting all throughout the night and revising. That is not going to help you. Revise smartly. What you're going to do? Have 3 layers. Same day micro revision. Whatever you are reading in the morning, you make a skeletal layer structure and at night try to revise it. 15 minutes at night, just reading the heading and trying to recall whatever you have read. Second thing, weekly compression. So take a A4 sheet. Daily you're doing right. At the end of 1 week, or for example, at the end of one subject, try to revise it. Try to revise, gain the knowledge of entire subject. Gain the knowledge of entire subject. So try to do what you are doing it. So for example, layer one, you have already by evening, you have read all the toppers places, take it toppers place or must to know. So let's define what exactly to do. Before sleep, take 15 to 20 minutes, close all your textbook, open your skeletal notes of the day, take the page in the workbook, what I have given. For each topic, you ticked, whatever you have ticked, ask yourself, can I reproduce the heading of this answer in 2 minutes on a blank page? Can you do that? Example, MI, definition, types, clinical features, ECG changes, complication, acute management, infective endocarditis, definition, Duke's criteria, complication, treatment, pleural effusion, causes, lights, criteria, management. Take a rough sheet, set 2 minutes timer, write only the heading from your memory. If you are able to write 70 to 80% of the structure, that means the topic is truly green. If you are not able to recall, that means still it is like a yellow signal. From red, you have just come to yellow signal. You need to go revise that same thing. Now, wherever you are struck, take your book, once again revise it. And before moving on from that day, same day revision will be helping you to stop forgetting before it even starts. Second layer, weekly compression. Once a week, say Sunday evening, sit with your notes, compress each major subjects into a single A4 sheet for that week. For example, week 1, general medicine, heart failure. Heart failure, what you need to read? Framingham's criteria and treatment triad. MI, what you need to read? Mainly, door to balloon time, door to needle time, complication list. Rheumatic fever, what you have to read? Jones criteria, prophylaxis schedule. Pneumonia, what you are expected? Hospital acquired pneumonia versus community acquired pneumonia, curb 65 criteria. And TB, what you need to read? To dots categories. And then what MDR means. Write it down. One line per topic. These are the hooks that you could not afford. You cannot afford to forget. That gives you hierarchy. Textbook, from textbook, skeletal notes, from skeletal notes, a weekly A4 compression. In February, these A4 sheets are going to be your fast revision weapons. Smart revision always moves towards smaller and faster formats. If you start yourself with a smaller version, then it is going to go on shrink when you go to a revision. Then it is not going to help you guys. Then you have this fear of missing out. Sir, I missed out something. Then you go back and read again the entire topic and waste your time. So third layer is the trigger based. Sorry, I think image haven't come. Never mind. So third layer is a trigger based revision. Instead of always revising subject wise, sometimes revise by pattern. Make it today or 20 to 30 minutes when I am very sleepy. I am going to revise all the criteria. Framingham's criteria, Duke's criteria, Jones criteria, Lights criteria, Curb 65 criteria. Try to write them whatever whatever you are there in your memory and correct it from the textbook. Similarly, one day, list day. So, what are the etiology day? What are the causes of clubbing? What are the causes of hematemesis? What are the causes of cyanosis? What are the causes of cor pulmonale? So, write down the classical list. Then one day, write about the scores. One day, write down the triads. So, like this, it is going to give you smart work because your memory always loves spacing, grouping similar structures, active recall under small time pressures. Clear? So this is how we are going to do. Same day micro, weekly compression. Then we are going to do a criteria day. We are going to keep a list day. Clear? Then comes the PYQs. Smart use of your previous year question papers. So your workbook is already built heavily from your previous year question. The question is how I'm going to use it intelligently. Many students only read ready-made answers. They don't even want to make answers. They are relied upon the ready-made answers. Or people ignore the PYQ in last 1 to 2 weeks because they have the fear of missing out. They move on, discuss about the various questions, but they miss out the previous year questions. Instead, use 3 pass PYQ technique. Take 5 essays PYQs from your must-to-know list of that week, like heart failure, MI, rheumatic fever, pneumonia, TB. These are the 5 things I have given you on the day one. Pass one, heading only, 10 minutes, 2 minutes per question. Write only the skeletal heading. Don't look at the book. Don't care about the perfection. Then one full answer. So randomly you select one PYQ. Take a notes, take a fresh paper. Imagine yourself sitting in the exam. Don't worry about the mark. You are sitting in the exam. Write down one full answer. For example, rheumatic fever. Write down one full answer. 10 to 12 minutes. Take like an exam. Focus on the structure, key points, time, everything. Then compare your skeletal notes with the full answer with your own skeletal notes or the structure in the Q bank on workbook. What you are going to check? Did you cover the epidemiology, etiology, pathophysiology, clinical features, investigation, management? Did you go in this line? Did you include all the essential criteria, scores which are relevant? This is good. This 3 pass cycle twice a week if you're going to do. That is going to help you in practicing the structure. That is going to help you in practicing the structure. Number one, it is going to help you practice the speed of writing and content correction. So it is going to help you to correct the content, whichever there in your mind. Much smarter than reading a model answers, isn't it? They're much smarter than reading an answer prepared by someone else. So what you do is short notes. For example, let's take short notes. So if you have a short notes like infective endocarditis, atrial fibrillation, Fallot tetralogy, JVP, acute left ventricular failure, cardiac enzymes, CURB65, sputum AFB staining, all this, etc. Use 30-second short note template. Definition, ஒரு crisp line. Key features, 3 to 4 bullet points. Key management, 2 to 3 lines. Key management, 2 to 3 lines. This is how you're going to learn. When you're going to learn like this, example, Duke's criteria for infective endocarditis. How your definition has to be? It is a set of major and minor clinical, microbiological, surgical, echo finding to diagnose infective endocarditis. What are the major criteria? Positive typical blood culture, evidence of any endocardial involvement on echo. What is the minor criteria? Predisposing heart disease, anything is there, fever, vascular phenomena, immunological phenomena, etc. And apart from that, newer definition gives you some pathological criteria, gives you some microbiological criteria, gives you some surgical criteria. And you're going to remember all these things. And this, why do you want to read all these things? It helps to differentiate between the definite versus possible infective endocarditis. So do revision like this. Take 5 to 10 smart short notes. Set a timer. Try to speak out or jot the template for each in 30 to 45 seconds. This trains your brain for fast structured recall for short notes and vivas also. Now, I'm going to tell you a last few minutes about the cognitive acts. Chunking, non-negotiable tick ritual. So now some brain acts are there to grind your sustainable. As a psychiatry resident, as we speak with many people, we many times gets like 9th standard, 10th standard kids. They are not reading properly. They are like always using phone. They are not following a schedule. The parents bring them here. So we sit with them. We teach this chunking. What is this chunking? Never sit down with a vague target like today I will do cardiology. Use your workbook. Heart failure is one chunk. MI is one chunk. ECG basis is one chunk. Drugs and emergencies is one chunk. Each chunk divide 25 to 30 minutes. One clear start, one clear end, one checkbox to tick. Right? This you can do. Then every morning look at the workbook page for the day and mark the 3 boxes as your non-negotiable. So that's why I give you one must to know and then one topper's place. In the must to know itself, select the questions that you are definitely reading it. Okay, whatever happens in the day, posting, fatigue, mood, these 3 has to be ticked before you go to sleep. This anchors your day and prevents guilt spirals. Then comes the tick ritual. Your brain hates open loops or loves completion and closure. Every time you finish a chunk, don't just mentally say done. Stand up, physically tick the box, take a sip of water, 3 deep breaths, do a small walk, do whatever you like, eat whatever you like. That tiny ritual will cause your dopamine to hit. It tells your brain you're winning, you're progressing. And smart study is not only about method, it is about the psychology. It's about the psychology. That's why I'm speaking with you guys. So, what I will tell you is motivation usually dies in 24 hours. Whatever I tell, after 24 hours, everyone will forget. But the system will survive. So, instead of feeling motivated now, you will all feel motivated now. From tomorrow, I'm going to follow this, sir. But you don't follow, then it's going to be a problem. So, let's keep it simply. For a 3-day experiment, let's do. After 3 days, let's again meet. For the next 3 days, for every new topic, use this 5-10-2 method. 5 minutes, scan the heading table boxes. 10 minutes, turn them into question. 2 minutes per question, read only to answer that particular question. Each evening, 15 to 20 minutes, same day, micro revision. 2 minutes drill, blank sheet, reproduce the heading of all the topic you tick that day. And one of these 3 days, do a 20-minute trigger session. Revise as many criteria, scores, list that you can from your memory, then correct from your book. And every day, choose 3 negotiable boxes. Tick them no matter what. At the end of third day, ask yourself, I will ask you, not even ask yourself, I will ask you in the live session, how much you could recall without opening the book. How is your anxiety compared to the days when you just read? When you just read, if you feel even 10 to 20% improvement in recall and confidence, this is our particular system that we are going to follow. You don't need motivational speech after that. You don't have to attend motivational speakers after that. You just need to keep the system running. You're already into RRR, revise, refine, and reinforce roadmap. Now you have the engine, how to read smart and how to revise smart. Use it, test it, and refine it. And remember, the examiner is not testing whether you have suffered 8 hours a day. Examiner is testing how clearly your brain can retrieve answers in 3 hours. In 3 hours. Studying smart is not optional. It is your responsibility to yourself, to the future patient who is going to trust you and come to you. You are becoming a great doctors. I am very sure that those who are attending today, be it 10, be it 12, be it 15, those who are attending this live today, at least I am contributing something to my own juniors, my own fellow friends, or something to the society. I feel very bad when we get in the random places when we feel students are not able, after completing MBBS, they are not able to tell basic questions. They are able to solve MCQs, but they are not able to think like a physician, think like a doctor. You are all trained to become doctors. You are not trained to become a MCQ answerer, isn't it? You are not a person who is trained to prepare and answer MCQs. You are trained to handle emergency. Just imagine you are going after your internship or during your internship, you are going in an aeroplane and suddenly a patient in front of you is succumbing to a heart attack or MI, and suddenly they are announcing in the flight, any doctors over there, and you are doctor but you are not able to raise your hands because you're not confident enough. That destroys your entire 5 years of studies, my dear. That shouldn't happen, at least to the people, those who are watching this video. And that's ultimate aim of me in conducting this RRR at free of cost, at a social motto. Why do we have to do that? Why should I spend my time after a duty hours? Yesterday I had a duty full day, 24-hour duty. And after that, I'm sitting here at that night. I'm talking with you guys. Why should I do that? Because something from me, I need to contribute to the society. And that's the ultimate aim of mine. And those who are watching this video, just imagine the aeroplane story I told you. If you are in that aeroplane, if you are asked, you cannot tell that, sir, I missed that question in my exam. I didn't study that question in my exam. That is not the answer that you are expected as an Indian medical graduate. You are called as IMG, Indian medical graduate. You are not expected to answer like that. And I hope that my dear juniors, my dear friends in this forum, you will not be like that, and you will achieve success. I'm sure that if you're following this method, you will be able to score not less than 80%, not less than honors. When you are invited to Tamil Nadu MGI University for named medals, you should think what I told you, that one fine day you are going to think and you will be messaging me. I'm very sure about that. So with that, thank you so much for attending. Share this video with your friends too. So at least one or two by your sharing, let them also join this movement. I don't call this as a group. I call this as a moment, a reform. And I want you guys to be a part of reform. Invite maximum number of people into this reform. Achieve success together. Success is like ocean. Everyone can achieve success. Even after everyone drinking water, you will be have some water left out in the ocean. Same way, success is like a very big thing. Everyone can share it, everyone can attain it. Okay. Thank you, guys. Good night. And I hope so that whatever I'm sharing in the group is helping you guys. Whatever I'm sharing in the group is helping you guys. Try to use it fully. Today's handout, I will share you within few minutes. Try to utilize it. I'm thinking again. See, I am thinking again and again. What else can I do for my juniors? If I am thinking like this, what stops you to think? What stops you to think to improve yourself? What stops you to think to improve yourself? You can improve yourself. You will improve yourself and you should improve yourself. Thank you so much, guys. Thank you once again for joining today's session. Thank you. So if you have any doubt, contact CT Krishnan. He will be very happy to help you. Contact me. We will be very happy to help you. So this is a forum where we are building trust with you guys. We are not building revenue with this. Okay. Thank you, guys. Thank you so much.